Hello and welcome to the Headache Doctor podcast. On this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'm your host, Dr. Taves, and on today's podcast, we are going to talk about heat versus ice. And I'm sure you've been aware of the trend in cold plunges, and I've had conversations with patients recently that have incorporated cryotherapy or a cold plunge into their routine and have found benefit in it. And so I was curious and wanted to research a little bit and talk about it on the podcast. One of the most common questions we get at the end of an appointment is, should I do heat or ice? And I wanted to talk about that as well. And that way we could direct people that are going through a process to this podcast as well to understand the benefits, pros and cons of heat versus ice. And then I'm sure you've trying to navigate your own symptoms have sort of dabbled in either heat or ice, whether that's some sort of hot pack or some sort of ice cap that goes on your head, whatever it may be, and you've maybe found some helpfulness or effectiveness either way. So I wanted to talk about like physiologically what's happening with those and how you should evaluate whether heat or ice is appropriate for your situation, and if you should invest in a $3,000 to $4,000 cold plunge ice bath unit, which are trending right now. And so let's get into it as far as heat or ice. So when people ask me that question at the end of a session, like should I use heat or should I use ice? It's kind of nuanced. I would say that my education in physical therapy school was when it came to heat and ice was essentially that both can have therapeutic pain relieving effects on the body, but physiologically they operate in different ways. And so when it comes to trying to evaluate heat or ice, like just as a general rule, it can be that you just try one or the other, and whichever feels more therapeutic, pain relieving, can be the avenue that you go down or utilize, because there's definitely a variable here that is personal to you. Okay, whatever you prefer, whatever feels better, and so they both can have pain relieving effects, and patient to patient can be different. And so based on your experience, there is weight in your specific experience that I would say is worth listening to. And so we don't need to necessarily overthink this debate on heat versus ice, but there are nuances. And so I'm going to help break down like how should you think about one versus the other. So when it comes to cold therapy, we've historically had on the market like cold packs, gel headbands or caps, neck wraps. And then we've got the full body immersion experiences that are now available, whether that's like cryotherapy or the cold plunges. And so when we look at cryotherapy, there are a lot of benefits when it comes to specifically researching that as it relates to migraines. We do see like a localized approach to ice applied or cryotherapy, cold therapy applied to the head or neck, the location of the pain. We see definitely a short-term reduction in migraine pain intensity. Neck cooling, so wrapping a neck wrap, an ice pack around your neck, definitely yielded some meaningful results when it comes to reduction in pain, reduction of inflammation in several studies. And then we've got a report study in 1989, but 65% of migraine participants rated cold wraps, 20-30 minutes, as moderately to completely effective, and then up to 80% in another study showed reduction or relief of their migraine symptoms. So there's some data that's looked. We've researched this. We've tried to understand it. And short-term relief with cold therapy, especially as it's specifically applied to the head or to the neck, these areas that are sensitive and irritated when you have a migraine. And I'm all for that. I think when it comes to any sort of intervention that can reduce inflammation, impact the transmission of the pain signal itself, and give the body something else to think about. And even like a light pressure on the skin, when it comes to understanding how sensory nerves respond, that light pressure or dull vibration type of sensation actually travels faster on a bigger nerve fiber and can drown out a sharp, painful stimulus. It's the same idea of when you bump your head on something sharp and you immediately put pressure on it and start rubbing it. So you intuitively know that that deep pressure is going to calm down any sort of pain signal. And so when it comes to ice and cold therapy, the vasoconstriction reduces blood flow, reducing inflammation, potentially reducing the transmission of pain itself, and then if you have some sort of compress, like the head strap or the cap, that's going to provide some pressure. And so the cold combined with the pressure is a really good way to sort of calm the painful response down. It's not necessarily addressing the underlying problem itself. Like if the neck's really irritated and you just put a cold compress on your head, the pain signal becomes less intense. And so, but as soon as that sort of impact wears off, you'll probably be back to where you were potentially. I'm not saying it's not worth trying, and I'm not saying that has to be the case. Like you definitely could see longer term benefit, especially if you're someone that your migraine will hit for a shorter period of time, and then you'll see it calm down. Definitely utilize things like cold therapy in order to reduce your need on pharmaceutical options. Okay. We also see a release of like endorphins or analgesics potentially when we go through something like cold therapy. And so there's good benefits to it, and it should be utilized, especially if you find yourself in the acute phase of things, meaning if you have inflammation or irritation, and that could be directly after, a treatment session, or maybe you did something that was strenuous or could have like increased the amount of irritation or inflammation through your neck. Cold therapy is going to be a good way to calm that down, reduce the blood flow to the area. And the blood flow and the inflammatory markers are what's essentially leading to that transmission of pain. And so calming that down is where you get that pain relieving effect. The limitations to this, like I said, are it's short-lived, so it's maybe 30 minutes to an hour of some type of relief. The full-body cold plunges that are really popular right now. I mean, in college as an athlete, we'd do cold plunges after hard practices and things like that, and it felt fantastic. So a couple of minutes in a cold plunge can be really therapeutic. If you've heard of Wim Hof and the Wim Hof method, he's sort of pioneered this way of thinking in cold exposure. All right. So if you look up Wim Hof, he's a guy that has like swam in like ice cold waters and climbed, peaks that are snow-capped peaks in like minimal clothing. And so he's kind of like he's pushed the limits of what the body can do by exposing himself progressively to cold. And the whole idea is that we comfortably pursue heat and things that are warm and nice and comfortable, but it sort of reduces our body's threshold for what it can tolerate. So essentially adding stress as it relates to cold to our body, and they're starting to see has benefits like cardiovascularly. You see both the autonomic nervous system, so fight or flight, rest and digest, and then the cardiovascular system, which they work hand in hand, have this sort of like when you expose yourself to cold, your heart rate will elevate, your body will you'll start breathing heavily. So your cardiovascular system essentially is like stressed in a sense, and that maybe it mimics sort of like what exercise would do, but you're just exposing yourself to cold and giving your cardiovascular system this like, okay, let's work through this. And it has a level of stress through it that builds up a resiliency or a tolerance. And then you get a lot of benefits like from the cardiovascular system. And then again, when it comes to full body pain relief and reduction, inflammation, recovery, things like that. And that's why it's becoming so popular amongst, I think it's the CrossFit community, but just in general, people are finding good benefit from it. And I do have patients that are using it. And anecdotally, I've got a few patients that say they find good relief from it. Now, the people that I would say are having more likely to have relief are those that are going to have sort of a level of tension that they're carrying through their body, level of inflammation generally, that maybe they have like shoulder dysfunction or they just like have tension, could be specifically on one side of the body, and they go do this cold plunge and they get the pain relieving effect from it, okay? They get the reduction in inflammation and their body just feels better. They potentially have more energy. Now, the risk is if you sit in it for too long, and I've heard this from people as well, like it's almost like you get hypothermia, like you just have these weird, I even have a friend who had like these weird hot cold cycles, like he couldn't figure out why his body was cold at random times, and or like people that just can't warm up after like too much exposure to the cold. And so definitely start small. Like if you're doing the full like cold plunge, full body cold plunge, just start with a short period of time, see how your body responds. And if you want to push it, build up gradually. Don't just go all in. Yeah. And then the cardiovascular stress, could potentially be a negative if it's too much, that sort of thing. So like if you have, let's say like heart disease or something like that, I would check with your doctor before, exposing yourself, just jumping in and, no pun intended, jumping in and going through cold exposure like that. Okay. But yeah, as far as like anecdotal reports and, it's kind of cool and encouraging that we can utilize something like cold therapy or cryotherapy and see a reduction in pain. And I don't think you have to necessarily overthink this. I mean, exposing yourself to cold like that is, the side effects, like I just said, if it's too much, it can have that negative impact on the body. But a gradual exposure to something like cold and increasing your body's capacity, adding that little bit of stress to the cardiovascular system so that it develops and becomes healthier, it is a good thing. And so if you get a pain relieving effect from it, and it seems to help your body's like overall soreness or the migraine presentation, I don't think we need to overthink that or be like too cautious about it. It's something that is relatively accessible as far as like, especially the locally applied cold therapy options are very accessible. And so, I would say go ahead and give it a shot, see how it works for you. Okay. And then we have the heat options as well. Okay. So when it comes to heat, so cold, we talked about vasoconstriction. So the constriction of the blood vessels reduce blood flow, but you have like endorphins and analgesics that are released and reduction in inflammation. And when it comes to heat, you have the opposite. So you have an increase in blood flow, but you also have benefits of like muscle relaxation. Whereas in cold therapy, you're actually kind of like tightening up. And then you have what's called the pain gate theory, which is the warmth is going to kind of override pain signals, similar to like the pressure I talked about earlier on the head, or that like low, like dull vibration or pressure sensation drowning out the more sharp, intense burning signals that would be pain. Okay, so when it comes to heat, what I would suggest is if it's after any sort of like body work or something physically demanding, and it's sort of in the acute phase. So shortly after the event, and there's inflammation running through your system, it's probably not the time to utilize heat. Now sometimes people will couple like cold and then they'll do heat, and they'll go back and forth, like cold plunge and then sauna, cold plunge and sauna. And there are benefits to that. But this is going to be more like if you're looking for muscle relaxation at the end of the day and you have like stress through your shoulders or something like that, that tension buildup can be helped by heat therapy. Okay. If it's right after like body work or manual therapy, it would be for the intent of like allowing mobility to improve, like if you feel tight or something like that. And sometimes that's the case. I would say most often after we work on someone, we're probably going to recommend cold. I mean, it's not a conversation we have a ton, but people do ask. But yeah, if things feel stiff, if things feel tight, if it feels like, like I just can't get it moving, I would say first go back and reference my podcast a couple weeks ago, because I talked about how movement and exercise is the best way to build resiliency, so we get out of that cycle of just feeling tight all the time. So the answer is not necessarily like, oh, you need to stretch and apply heat, even though that kind of feels like what you need to do and is more accessible because you're just, I mean, you can like apply heat on the couch while you watch a show. But getting into, laying down and applying heat to something is sort of, I mean, I'm cautious to recommend that. And even with cold, like I'm cautious to recommend someone sit on the couch and just like slap a heat pack on them, because, and I've interacted with patients that do this quite a bit. And I'm, again, not guilting anyone, but it's generally when you apply heat or ice, you're sedentary, right? You're like, oh, I'm just going to lay down and apply heat, or I'm going to lay down and apply ice. And what we're trying to get away from is the sedentary positions. Like very rarely, if ever, have I come across someone where it's like, okay, you have adequate or too much movement throughout your day. Okay. Most of the time it's either like too much repetitive activity or too much sedentary, like lack of activity. And so I'm cautious and careful to recommend something where it's just going to put you on the couch or mean that you're sitting while applying this to your neck or wherever it is, your head. Okay. Now, if you are able to apply heat while you're like doing a foam roller stretch or like maybe going on a walk or something like that, and even if it's like you're just kind of out of commission, you need to lay down and you have good positioning posture with the pillows like we talk about on the podcast, and then you want to apply heat, that's great. No problem with that. But it's sort of like, oh, I'm just going to relax, apply the hot pack to my neck, and, put on a show or read a book. That's the sort of thing like in the evening, if we think that's therapeutic, if we think that's helping, if we think that's getting rid of muscle tension, I would say we should probably rethink that and introduce more movement, more exercise, that sort of thing. Okay. But heat's going to be helpful for increasing blood flow, improving mobility, reducing stiffness, and feeling that it's helpful for that muscle tension. Again, this is like a short-term benefit type of thing. Okay. So we're not actually like changing anything with the mechanics of how you move or how the muscle's functioning, or the underlying issue is still there. And so don't think like, oh, I'm relaxing the muscle and so now it's good. And heat's the only avenue I need to actually get out of this. It can promote like just that comfort relaxation. That's like when you go to a massage therapist or a salon or something like that, they will use like heat stones or warm towels. Hot tubs. Like we know intuitively that our parasympathetic nervous system is going to be activated when we're introduced to heat, right? And so that's where we get the benefit of heat. Sometimes heat exposure, like a hot tub, can be sort of increasing the inflammatory response that's already there for people, and then they kind of feel worse and like they have more of a headache after getting out of a hot tub. So like there's balance here, and that's why I'm saying like this isn't the cure-all. It's very personalized. So figure out what works for you. But this is like the physiological benefit. Both of them are short-term, have kind of different functions. And in general, like cold therapy is going to be to reduce pain more acutely, inflammation. Heat therapy is also going to reduce pain, going to be more geared towards like, general muscle tension, maybe at the end of the day, if you feel like you're tight, something like that. Okay. Yeah, in either scenario, like whether it's cold therapy and you're in it for too long and you were just like sort of tightening up, trying to tolerate the cold, and then you get out and like your headache's worse. Or in heat therapy, it's like too much heat exposure. Now your body's got like sort of this response of inflammation that's contributing to your headache. So I've seen both, right? Like too much of a good thing is a bad thing. Okay. And then as far as heat exposure, it's definitely not the type of thing you want to do right after something's inflamed, right? Because it's just going to add to the inflammation. And the inflammation is natural, so we don't need to like avoid inflammation at all costs. It gets how our body heals and sends the alarm signal if something's off. But we don't want an improper response by like contributing to what the body's naturally doing by encouraging inflammation. Okay, so if you have like an acute migraine attack, it's probably going to be cold with a compress, with some compression, which is going to be helpful. Tension type headache is probably leaning more towards heat. But then again, the qualification of like, let's move, let's improve the body's resiliency, tolerance. Listen to that podcast a few weeks ago. Post-manual therapy is probably going to be ice first, then heat, the next day, something like that for relaxation if things feel a little stiff the day after. Chronic stiffness is going to be more of the heat oriented. And then of course it's just coming down to your preference. There's not like, so the pros and cons are not like these dramatics, like you have to do this every time or you have to do that every time. You know yourself, you know your body, and you can try these in different settings at different times of day in response to your headache or migraine. And I would say that's fine. Like if your body responds well to something that you've done and it sort of even contradicts what I've said here, that's okay. We don't have to overthink this necessarily. So there you go. There's the difference between heat and ice and cryotherapy, cold plunges. And so should you invest in a cold plunge? I mean, sure, if that's an avenue you've gone down and you've tested in and it feels like it helps your body, I think that could definitely be a good avenue. You could also just start with like, cold showers and expose yourself to like cold water at the end of the shower. Follow Wim Hof and look him up and see what cold therapy exposure is all about. There could be some benefits there as well. But in any regard, thank you guys for going on this journey with me today on cold versus heat. I hope it's helpful for you. As always, I appreciate you guys listening to the podcast week in and week out as we continue on this mission to empower and educate everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.